Good morning, Miss Edmond. My name's Natalie. I'm a nurse at the hospital. How are you today?
Good.
I hear that you're going to have surgery next week. Do you mind if we visit for a minute?
Yeah, that's okay.
Okay. I wanted to talk to you about some issues that could happen during surgery, and one of them is developing a pressure wound.
Mm-hmm.
Do you know what a pressure wound is?
No.
A pressure wound is a wound or an injury that you would get from not being able to move around, staying in one position for a long time. For instance, if you are lying down on a table and you can't move your head, when your head presses against the table or your tailbone presses against the table or your heels press against the table, it causes skin tissue issues. And so you may develop a wound there. So what we're going to do is take some measures to prevent that from happening. And we know that these measures work because there was a study done in Hawaii called a quality improvement study and a quality initiative study. A study is kind of like a science project. Did you ever do a science project in school? Okay. So some doctors and wound care specialists, nurses, and some researchers got together, and they figured out that they could put a 5-layer dressing on these special places on your body that might develop a wound. And they could prevent this from developing before the surgery, after the surgery, and during the surgery. Because before the surgery, you're sedated and you may have to lie there for a while. During the surgery, we never know how long the surgery is going to take, so that might be a lengthy time. And then after the surgery, you're recovering and you may have to lie down still for a while. So to prevent this tissue from having an injury, they put this dressing on. And they found in studies from this hospital in Hawaii, a military hospital, that they found that out of 1,000 patients, and this was in 2018, before they decided to implement these preventative measures, they found out that 620 of the patients in 2018 to early 2019 developed pressure wounds. After the end of 2019, when they decided to implement these pressure wound techniques or preventative measures, they found out that 0% developed a pressure wound. So this was a very, very important study, and they've adopted it. Our hospital is trained to adopt these preventative measures. So do you understand what might happen before surgery?
Mm-hmm.
Can you tell me what preventative measures we're going to take to make sure that you don't have a pressure wound?
They're going to apply a 5-layer dressing to places that could lay against the table for a long time that are easy to have a wound happen. So like the back of my head or tailbone or the heels of my feet will have a dress in place to where it can help stop the wound from forming there, like cushion place.
Okay. Do you have any other questions?
No, ma'am.
All right. Well, good luck with your surgery, and let me know if you have any questions.
Thank you.
So I will perform hand hygiene and exit the room.